Our next startup is MetaBid, which is turning the way you select doctors on its head to have doctors select you. Ralph Weber, our entrepreneur, started this company because his wife had to wait 2.5 years for surgery when she was in her cabinet. It was not surgery, it was Ralph, and he built this as a consumer model. Now it's coming to the US and globally as an employer commercial type of model. Let's hear it for Ralph and for MetaBid.
Well, thank you, Steve, panelists, and most importantly, good morning, San Diego! So I want to talk about MetaBid for employers, how it works for employers. It's very, very important. One of the key issues in healthcare in this country, as most of us know, is the huge variance in allowable charges within a PPO network. Same network, same market can have huge variance, 565%, I've seen 1,000%. In the city of Oklahoma City, I've seen a variance of 565% for hip replacement. 14,600 is the Medicare allowable. One hospital within the network allowable charges are 16,900. Another hospital 2 miles away, 95,799. That's in the same market, the same procedure, and no measurable difference in quality. We have our target rate, which is $14,070, and the target rate is defined where 1/3 of bidders will bid at that rate or lower. The problem, of course, as we know with healthcare, we have a lack of transparency in cost and quality, and a lack of competition. We have no market forces at all in healthcare, none that are negligible. Upfront costs are too high, and employee out-of-pocket costs are too high, leading often in low engagement, low participation in health plans. The opportunity, we are an online medical bidding platform that has a competitive bidding process. We reduce employer or payer costs by 38 to 65%, and we reduce member out-of-pocket costs while increasing their quality and choice. The way it works is very simple. The employee creates a profile and submits a request. MetaBid contacts doctors and facilities and sends them an opportunity to bid on that request. The doctors will submit bids and second opinions, and the bids are based on bundled case rates. The facilities will add to the bundle. It's all presented together by the time it gets to the employee. The employee looks at the quality, the outcomes, the training, education, experience of the provider, and selects a provider. It's very simple. Our results for the last 3 years, we have reduced the cost for small employers by up to 67%. Large employer with 80,000 employees, we have saved them 81% versus bill charges and 54% versus healthcare Blue Book's fair price. In the last 3 years, our engagement has gone up by 329%, which has actually reduced the procedure cost by 27%, because the bidders see what the other bids are being accepted, because there are no price signals of transparency in healthcare right now. Our target price is defined at the price at which 1/3 of bidders will bid at or less. Our median bid is 108% of Medicare. Our target price is 82% of Medicare. What makes us different? We're disruptive innovation. We have no preferred provider network restrictions for much of the care. We create a price just for you, transparent value, medical care across state lines, and we reduce the middlemen and the cost thereof. What are clients saying? These are our actual end users. Perry Hunt was in NBC News a few years ago. He got a hip replacement through us, saved $49,000. He said, "I couldn't be happier with my experience in surgery. Thank you, MetaBid Service. It's a wonderful website that's allowed me to find the right doctor and get the right price. As a result, I got my life back." Regina Warner in Dallas, she said, "At first I was resentful of having to make a request online, but then we found out how much more personable it was. And what she found is that we were clinging onto a familiar broken system." What we do is innovative. It's different, it's disruptive, but it really works and the employees love it. We reduce healthcare costs and by 38 to 60% while reducing out-of-pocket costs for the employees. We increase their quality. We create direct contracting, bundled case rates for single episodes of care, access to different treatments across the U.S. and even overseas. And when we bundle the case rates, that includes the second opinion, because when somebody makes a request, you're going to get doctors saying, you know, I don't think you need a knee replacement, I think you need a knee arthroscopy. We will be, and I guess Steve's probably going to talk about that, we'll be at the innovators table between 9:55 and 10:25. If you'd like a white paper, a copy of my book, please write down my contact information and talk to me then. Thank you.
She also told me to talk to her. That's how it's done. Okay, questions?